Hello, my name is Hannah Garcia. I'm going to be doing a presentation on communication barriers among non-English speaking population. So, profile description of population. I am going to be primarily speaking about the Spanish-speaking population. I decided to pick this population because my husband has a family that has a lot of immigrants that are here that are non-English speakers, so I have a lot of exposure to that environment. Profile, so size of population. So locally in Weber, Morgan County, 24,388 Spanish or Spanish Creole speakers out of a total of 225,285 speakers. Statewide, Utah State has 245,945 Spanish speakers at home out of a total of 2,554,331 speakers. Nationally, within the United States of America, 61.8 million individuals speak another language other than English at home, with a population total of 329,541,394. Internationally or worldwide, Spanish is the second most common language spoken worldwide, with a total of 400 million Spanish speakers. Differences locally versus nationally. Utah has a total of 9.6% Spanish speakers compared to 12.4% of the total United States population who speak Spanish. Contributing factors or social determinants of health include access to health care, social norms and attitudes such as racism and stereotyping, and language and literacy. In the study reviewed titled Inclusion of Non-English Speaking Patients in Research, a Single Institution Experience, they found that despite the increased amount of non-English speaking patients, the amount of non-English speaking patients enrolled in particular research studies that could potentially be beneficial for their health did not increase at the same rate. Therefore, social determinant to the non-English speaking population shows that barriers include access to health care. Particular contributing factors or specific concerns includes a Pew Research finding that 18% of foreign-born Hispanics are living in poverty in comparison to only 13% of all Americans. Another study published in Language Barriers and Access to Psychiatric Care, a systematic review, they found that a decrease in language proficiency was highly correlated with underutilization of psychiatric services. So contributing factors or root causes. So first one I looked into are why are non-English speakers at a higher risk for psychiatric health issues? Verbal communication is a large piece of psychiatric health and diagnosis. Language is utilized to find and deliver the correct treatment among immigrants and refugees, which creates a huge barrier when there is a language barrier. The second question I had are why are non-English speakers at a higher risk of health issues and health access? So that could be contributed to a lack of cultural awareness and lack of interpretation and translation services, which can contribute to an increased amount of health issues and health access for non-English speaking individuals. Contributing factors, reviewing over Maslow's hierarchy of needs. So the MET needs are physiological needs, which includes air, water, food, shelter, sleep, clothing, and reproduction. Self-actualization needs are met, which includes the desire to become the most that one can be. However, unmet needs include safety needs, such as health needs, resources, and employment opportunities due to language barriers. Love and belonging is another portion that's not met because of lack of belonging within the American culture, and esteem portion may be unmet due to lack of respect and recognition from fellow Americans. So the anticipated functioning level includes physiological because they are able to get air, water, food, shelter, sleep, clothing, and reproduction. And self-actualization needs are met, which is related to the desire to become the most that one can be. Likely health outcomes. Safety needs are not met due to poor access to healthcare needs, lack of belonging affiliated with psychiatric distress, and esteem related to lack of respect and recognition. Specific concerns related to communicable diseases or infections. So tuberculosis TB cases among Hispanics or Latinos surpassed all other racial or ethnic groups in the U.S. 87% of all TB cases were among racial and ethnic minorities. The Center for Disease Control and Prevention reports that in 2014, gonorrhea cases among Hispanics were 1.9 times greater than the cases among Caucasians. Chlamydia cases among Hispanics were 2.1 times greater than the cases among Caucasians, and syphilis cases among Hispanics were 2.2 times greater than the cases among Caucasians. specific concerns such as non-communicable diseases or infections. So Hispanics have a lower death rate compared to the general population in the U.S. Hispanics have an equal rate of hypertension compared to the general population in the U.S. Hispanics have a 50% greater mortality rate from diabetes in comparison to Caucasians in the U.S. They also have a 23% greater obesity rate in comparison to Caucasians, 25% less colorectal screenings compared to Caucasians, and Mexicans in specific are approximately 2 times more likely to die from chronic liver disease and cirrhosis in comparison to Caucasians. Specific concerns such as self-care or self-harm, older Hispanic adults and youth have a higher likelihood of psychological stress related to immigration and acculturation. Around 10% of Hispanics with a psychological disorder uses psychological services from general care practitioners. Only about 5% of Hispanics receive psychological services from psychological providers who are more in tune and educated on psychological services. Therefore, they're able to provide better care. Specific concerns related to risk for harm by or to others. So in 2012 to 2015, half of the violent victimizations in the U.S. were the same race or were both of Hispanic origin. Violent victimizations includes rape, sexual assault, robbery, aggravated assault, and simple assaults. Ways to mitigate this problem includes providing opportunities for non-English speakers to receive resources related to employment opportunities, which may decrease the level of robberies and potential assaults. Cultural environment, portrayal, inaccuracies, and vulnerabilities. So in the media, Hispanics or Latinos are underrepresented in films. Discrimination and racism. So undisguised and concealed racism and discrimination occurs. Hate crimes are increasing. So an example would be the American Civil Liberties Union sued the United States Customs and Borders Protection due to detaining 2 U.S.-born Latino women in May of 2019 for speaking Spanish at a store. So therefore, discrimination took place. As far as assimilation, Latinos are typically reinforced to assimilate. However, evidence shows that assimilation through economics, language, and culture occur by the 3rd generation. So assimilation is occurring by the 3rd generation. So as far as cultural environment and family support, research shows that providing holistic family programs and rules benefiting both parents and their offspring will assist with formulating supportive atmospheres for Latinos or Hispanics. Research has indicated that students are better off from an academic, social, and financial aspect when parents are engaged in their schooling. By improving these students' finances, it will potentially increase the likelihood to access to insurance, which will improve their access to valuable health care. As far as cultural environment or peer support, in a mental health research study, they found that family support was not a huge contributing predictor of receiving formal or informal treatment for any ethical or racial group, but support from friends for Latinos and Asian Americans in comparison to Caucasians was affiliated with a higher chance of seeking long-term informal treatment. For both Latinos and Asian Americans, there is a higher reliance on and willingness to disclose to friends, which may possibly facilitate a pathway to informal mental health services, possibly by decreasing the stigma affiliated with the use of mental health services. As far as cultural environment within the political and legal system, within the political system, a Pew Research study found that there are 147,000 Hispanic eligible voters in Utah, 8% of Hispanic eligible voters out of Utah's total population. Within the legal system or criminal justice system, nationally, Hispanics make up only 17% of the total population in the U.S. However, Hispanics make up 48% of those prosecuted for drug offenses. Research has shown that Hispanics and Blacks are unequally targeted within the criminal justice system. Cultural environment, so potential barriers, includes segregation, racism, and hate crimes. This is an example right here. This guy went into a tire shop located in Salt Lake City, Utah in November of 2018, and he had mentioned that he had the intent to kill Mexicans, and then proceeded to fight the business owner and his young son with a metal pole to the point that the owner's son was sent to the hospital and pronounced to be in critical condition. Therefore, obviously, hate crimes are occurring. So as far as cultural environment, danger, and shunning, so hate crimes occur in Utah, as discussed in the previous slide. In an article in Los Angeles Times, it reviewed through the fact that in 2018, hate crimes increased to the highest level in 16 years, a total of 485 anti-Latino crimes, which increased from 427 in 2017, and crimes targeting Latinos increased by 41% since 2016. As far as health disparities and socioeconomic status and gender, in a study conducted among alcohol use among U.S. Hispanic adults, they found that men have a higher rate of at-risk drinking than women, and that women had an increased likelihood of alcohol use with younger age, higher education, full-time jobs, and acculturation post-adjustment. However, for men, having a lower income or a higher income, which was not specified, and working full-time was affiliated with at-risk alcohol use. Interventions to assist with decreasing alcohol consumption needs to focus on alcohol abuse and prevention programs among the Hispanic or Latino communities. Health disparities, including race or ethnicity outcomes. So we've already discussed this, but Hispanics in comparison to Caucasians have an overall lower death rate, the approximately 50% increased mortality rate from diabetes, 24% higher chances of poorly controlled hypertension, 23% more obesity rates, 25% less colorectal screenings, are 2 times more likely to die from chronic liver disease and cirrhosis, in particular among Mexican individuals. So health disparities and religious outcomes. So 34.4 million identified Catholics are Hispanic. 50% of Hispanic adults identify as Catholic. So Catholic-affiliated hospitals are governed by ethical and religious directives for Catholic healthcare services, also known as ERDS. ERDS prohibits multiple modalities of reproductive health care, which includes contraception, emergency contraception, sterilization, some treatments for ectopic pregnancies, multiple fertility treatments, and abortions, despite the fact that patients' lives or health is compromised by pregnancy and it may go against the patient's wishes, the urgency of the patient's conditions, the provider's medical discretion, or the standard of overall care within the healthcare profession. So in the study, it showed that in 19 out of 34 states, women of color have a higher likelihood of giving birth at Catholic-affiliated hospitals governed by the ERDS. In New Jersey, around 1 in 25 births are to white women in facilities that are governed by the ERDS. The amount of Hispanic women is around 1 in 6, where they had double the amount of births at Catholic hospitals in comparison to white women. Health disparities as far as geographic region. Study rural communities versus urban communities. They found a poorer overall health, difficulty retaining providers, and issues maintaining health services. Options include telehealth or telemedicine. So examples include a diabetes management study in which they study the behavior and psychosocial outcomes and patient satisfaction related to telemedicine for reach, education, access, and treatment models. The results of the study displayed that there was a drastic improvement in empowerment, self-care, which included compliance towards diet and monitoring, and decrease in diabetes distress. Patients reported that they had increased levels of patient satisfaction too. Therefore, the utilization of telemedicine and telehealth within rural communities is definitely beneficial, as shown in the study. As far as health disparities, implicit or explicit biases, they found that 52% of Hispanics reported racial discrimination or unequal treatment. It can vary by age. About 65% of Hispanics between the ages of 18 to 29 stated that they experienced discrimination or unfair treatment due to their race or ethnicity. However, only 35% of Hispanics who are 50 years or older stated that they received discrimination or unequal treatment due to their race or ethnicity. And U.S.-born Hispanics have report a greater likelihood of racial discrimination or unequal treatment compared to immigrants. Health disparities in regions of the world. So I found that in Mexico, the health system has small private systems, universal health insurance programs, and public systems. In Pan American Health Organization stated that Mexico's healthcare system is unequal. There is high quality healthcare services and institutions, but most people are unable to afford the care. And here are my references. I hope you guys enjoyed the presentation and that you guys learned something. Thank you so much.